Torticollis can be a stressful and troubling diagnosis for parents. It sometimes seems like a never-ending battle to work to get things not only back on track structurally, but also with their child's overall development. As pediatric chiropractors, we specialize in the care of these common infant challenges, and the one thing that we can also tell you is this: so many of them are missed by the average pediatrician. In this video, we're going to cover 4 main things that you need to know about torticollis and plagiocephaly, including how to find out if your child has these challenges and what you can do to help. With the rapid and significant rise in birth intervention and birth trauma, we see more and more cases of torticollis every year. Unfortunately for most parents, traditional medicine has not updated their understanding of what's causing it and how to best take care of it for some time, leaving most families, like Nathan's family, with only traditional treatment options, like physical therapy, that do not get to the root cause of the problem. Nathan's torticollis was affecting his quality of life in many different ways. He struggled to hit his milestones, he felt stiff, uncomfortable, and locked up most of the time, and suffered from constant ear infections. His mom was desperate to find help and relief for her baby because his occupational therapy wasn't doing the trick. While researching one night, Nathan's rock star mama stumbled upon chiropractic care. Fortunately, there does seem to be a shift happening in this generation of parents who are seeking out pediatric chiropractic care more often and earlier than ever before. These parents and families are seeing incredible results with a more gentle, effective, long-lasting approach to their child's torticollis. So how does torticollis happen, and what is the root cause? Torticollis is diagnosed medically as congenital if it is caused by abnormal positioning of the fetus while still in the womb, which we most common think of with things such as breech positioning or lower amniotic fluid. But the most common form of torticollis is acquired, and the most common cause is birth trauma. The amount of physical strain or tension and placing on a baby's head and neck during birth intervention, such as forceps delivery, vacuum extraction, and C-section, is significant, and many times leaves the child with a significant subluxation that contributes to the torticollis. Subluxation has 3 main components. First, there is a misalignment and abnormal positioning of the spinal vertebra. The second is that there's a fixation and reduced range of motion in the segment and region of the subluxation. And third, neurological interference and imbalance caused by reduced amounts of proprioception and increased amounts of nociception. Proprioception is that word that we use to describe how you can tell where you are in the world, and nociception is what we use to describe pain. So simply put, the more severe and apparent the torticollis and its related misalignment and fixation, the more severe the subluxation patterns likely are for the child. So why are mild to even moderate cases of torticollis completely missed by the pediatrician? The first thing we'd encourage parents to do if they're concerned that their child may have torticollis is not just relying on their pediatrician or medical doctor's exam findings. Of course, pediatricians are trained to perform physical exams in such a way as to spot neuromuscular challenges like torticollis. Still, they don't have nearly the experience or detailed training in those systems as a pediatric chiropractor or physical therapist would. If the pediatrician does spot torticollis for a child, they most likely will refer to a PT who will then show the parents a few positioning and stretching exercises that they can do at home to try to help alleviate the torticollis. However, most parents report to us that those stretches and exercises are extremely painful for the child and almost tend to aggravate the condition because it leaves the child in a sustained state of fight or flight tension. This is something known as dysautonomia. Now, third, traditional treatments such as physical therapy and helmets don't always get to the true root cause and the neurological component of the torticollis. This is why parents routinely report that when they put pediatric chiropractic as the foundation and first choice for their child's torticollis, it then makes all the physical therapy stretches and positioning work easier and far more effectively. As PX docs, we love nothing more than working in conjunction with your child's therapy team for maximum results. The pediatric chiropractic approach to caring for torticollis is so often the one parents feel the most makes the most sense, and it can be summarized in these 3 simple and safe steps. First, we find and locate the exact location and severity of those subluxations. Then we make safe and gentle neurotonal adjustments to relieve the tension and remove the subluxations. And then we encourage parents to watch closely for reoccurrence of the torticollis around growth spurts, teething, colds, illnesses, or other stressful events that the child may experience. So why do pediatric chiropractors look deeper than any other practitioner? We use insight scans to really find and locate the exact stress and dysfunction on the neuromuscular system. One of the real keys to caring for torticollis is not just using positioning and range of motion testing as only clinical criteria for resolving the condition. As pediatric chiropractors, we routinely examine and evaluate kids ages 5 and up who had torticollis as an infant, did traditional medical and therapy treatment only, and still have retained torticollis all those years later. That is easily found on our exam and insight scans neurological evaluation. So in many cases, parents can start to see results and see their child experience relief in just a few visits, and overall, it generally takes a few weeks or even a few months to get full resolution of the torticollis. Before we get started, we will sit down with you at what's called the report of findings visit to show and discuss your child's exact personalized care plan of how long it will take and what it all entails. There is no cookie cutter approach to torticollis where each child gets the same stretches and positioning exercises. The examination and scan process is crucial to make sure that we find the exact root cause of your child's challenges and make the right adjustments to get things taken care of. 1 month into Nathan's care plan, his digestive issues and eczema cleared up. In month 2 when his mom saw a huge difference. His mobility improved drastically and he started hitting milestones and said goodbye to ear infections. If your mom or dad gut is telling you that there is more going on than your pediatrician or therapist can fully explain and address, then Neurologically-Focused Chiropractic Care is perfect for you. We specialize in diving deeper and doing a more thorough assessment than anyone else out there, making sure that we get to the root cause of the torticollis.